Welcome back to my Painted Anatomy playlist, the series in which I draw anatomical structures over my own skin. The opponent's pollicis is a short intrinsic muscle of the palmar surface of the hand and the largest and deepest of the three muscles of the finar eminence, the large muscular bulge we have proximal to the thumb. And, as the name implies, the opponent's pollicis is responsible for opposition or opposing the pollicis or the thumb. So, opponent's opposition of the pollicis or of the thumb. So, I guess we're done here. All checked out. Thanks for having me. It was a pleasure having your review today, and see you on the next video. Except, what is opposition? What's this complex and so talked about movement? Well, I've sure heard that one of the distinct characteristics of us humans is having an opposing thumb. Because opposition is actually a complex movement, a sum of a lot of other smaller movements with a single purpose, touching the tip of your thumb with the tip of any of your other fingers, or in a more technical light, bringing together the palmar aspect of the terminal segment of the thumb to contact the flexor aspect of any other digit. Pretty much the same thing, just with more beautiful words. Opposition is actually achieved through a combination of carpometacarpal flexion of the first finger with some internal rotation and some degree of adduction of the pollicis. And the reason we bring all these movements together into a single complex movement, opposition, is because it's one of the major factors in allowing us to use instruments. From sculpting a bone X to using your smartphone, opposing the thumb with the other fingers is one of the most important movements when trying to use a tool. Flexion is clearly the most important movement here because it's what allows the thumb to come closer to the other fingers. So, carpometacarpal flexion is what will allow the pressing movement. However, without some internal rotation, we will get flexion towards an axis perpendicular to the other fingers, making it impossible to actually grip something. And without some degree of adduction, we will just flex the finger too far away from the hand to actually allow us to press on anything efficiently. So, we will use some small degree of adduction, some degree of internal rotation, and carpometacarpal flexion. Together, these three come together to form the movement of opposition, which allows us to use most of the tools. And to pull the thumb proximally and medially, this muscle must originate proximal and medial to the thumb, so somewhere in the wrist, and insert on the thumb. So, if you've watched my other videos on short muscles of the hand, you'll know that pretty much all of them originate from the flexor retinaculum, the large transverse ligament above the carpal tunnel, and from some other carpal bone. And, like most of them, the opponent's pollicis muscles originates mostly from the flexor retinaculum and also from the trapezium carpal bone, specifically from the tubercle of the trapezium carpal bone. And it inserts into the full length of the anterolateral or radial margin of the first metacarpal bone, the metacarpal bone of the thumb. No exceedingly complex origins or insertions for the opponent's muscle. The movement is already exquisite enough. And regarding supply, blood supply, if you remember the other short muscles of the hand, you will remember that the finar eminence is largely supplied by the radial artery, which is right besides it. So, as is the role in the finar eminence, the opponent's muscle will be supplied mostly by the superficial palmar branch of the radial artery, the branch that will give rise together with the superficial palmar branch of the ulnar artery to the superficial palmar arch, but since the opponent's muscle is a very deep muscle, the deepest of the three muscles of the finar eminence, actually, it will also receive some supply from deeper branches. The same as we saw with the deep head of the flexor pollicis brevis. So, which branches of the radial artery pass through here and are deeper to the superficial branch? Well, we have the princeps pollicis artery, the main artery to the thumb, passing through here, and we have the radialis indicis artery, the radial branch to the index finger, right here. So most of the supply will come from the superficial palmar branch of the radial artery, and some may also come from deeper branches of the radial artery, such as the princeps pollicis and the radialis indicis. And you won't be surprised to hear that this is not the single characteristic the opponent's muscle shares with the flexor pollicis brevis, because like all muscles of the finar eminence, the opponent's muscle is innervated by the recurrent branch of the median nerve. Makes sense, the median nerve is the more radial nerve for the palmar surface of the hand, and the finar eminence is innervated as a whole by the recurrent branch of the median nerve. However, in the flexor pollicis brevis we saw that the superficial head was always innervated by the recurrent branch of the median nerve. However, the deep head was innervated by the deep branch of the ulnar nerve. And what I said back then was that since it was the deep head, it made some sense. It was the single exception in being innervated by the deep branch of the ulnar nerve. Well, the opponent's pollicis is the deepest muscle of the finar eminence. So, while in 80% of cases it's innervated by the recurrent branch of the median nerve, just like all finar eminence muscles, in 20% of cases, since it's the deepest muscle of the finar eminence, it will be innervated rather by the deep branch of the ulnar nerve. This is just some anatomical variation, and if you just want to keep it simple, just remember finar eminence, median nerve, finar eminence, recurrent branch of the median nerve. But if you haven't seen my flexor pollicis brevis video, maybe go check it, and while you're at it, maybe check all my pain anatomy videos, especially the hand anatomy ones. After all, you are interested in hand anatomy, you've watched this video until the end. E se você fala português, certifique-se de ver também o meu canal em português. By the way, thank you for watching all the way until the end, and I hope to see you on the next one.